I had an elder that once asked me as a nurse, Connie, where's the Salit of my nephew? His nephew had a history of brain injury and addiction, and he noticed changes for this young man, and he wanted an explanation of why, medically what happened, and where was this young man's spirit.
Welcome, everyone. I want to take this time to introduce you to a very special colleague of mine, Kix, from the Nimo Brain Injury Society. She's here to answer some of those questions, that you may have around our loved ones that live here in the streets of Nanaimo or in Vancouver or in Victoria.
What Connie asked me to address is the toxic drug crisis that we're in right now, and the connection between brain injury and homelessness, mental health, and substance use. And the research shows that if we look at our population that is unhoused, that 50% of those folks have a brain injury. And the toxic drug crisis that we are seeing can also lead to brain injury, because what is happening when someone overdoses, they stop breathing. An anoxic brain injury, a brain injury that's caused by lack of oxygen. So that's the connection that we see. It's very challenging for the family members because they see their loved one and who they were potentially before this happened and who they are now, and they see often those struggles.
Snuneymuxw hosts elders' luncheons, and the idea is really to bring different vendors, different healthcare professionals, different nonprofit organizations to speak to our elders so that they know what's going on in the communities. Many of our elders have been asking about their family members, how to best care for them, what they can do, where they can turn to.
One of our doctors is specialized in addictions, so we're really trying to blanket our people with the care and the support that they need.
As one of the nurses that work in the nation, as one of the caregivers for our nation, our role collectively is to advocate for our elders, for our families, for our community members in general. Elders are such an important part of our healing. I think having time with elders provides me with the ability to create a platform and a dialogue, and hopefully the information that I learn and that they learn together, we go back and help our community members. And I'm grateful that elders are able to acknowledge that there is a crisis, the overdose crisis, the homeless crisis, because without that acknowledgement within community, we won't be able to talk about solutions.
I'm grateful for Connie and the Snuneymuxw Health, bringing all this to the community, hoping we can better our children. It would be good if the elders could pass things down to kids, with all of this information. Because like I say, they're looking for a way to turn for help. And with the elders, they'll have somebody to turn and talk to as long, they can make time to talk to these kids.
As a caregiver, I would say I'm an advocate and a navigator. That's why you become a nurse, is to care and love for your people. This work is rewarding because the longer you work in a community, the more you see the positive results. There's no greater joy than to see someone have wellness in their life, have peace in their life, have light in their life, a way to come home. If they've been away from home, doesn't matter if it's 18 days or 18 years, and you're one of those people that open the door. And I feel our health center, every door is the right door. I really, really believe in not so much one mind, one heart, one spirit. That's why I became a nurse.